In the beginning of the Civil War, the U.S. Army had a medical corps consisting of all 98 surgeons and assistant surgeons. No one called them doctors, they all called them surgeons back then. The corps only had about 20 clinical thermometers. They didn't have the modern microscope until 1863. Morphine was the lead pain-killing drug of the time. It was either rubbed or dusted into the wound. Sometimes they were given opium pills, but the doctors did not know that they were addictive at that time. When many soldiers came back from the war, they could find opium at the local druggists, so it was very easy to get. Doctors only attended 3 semesters of 13 weeks of medical school. Most of the schools at the time were just diploma factors, providing actually very little training. The good medical schools were like Princeton and Yale. These schools' programs were the only 1-year programs, although 2 years was recommended. When the mini balls, or the bullets that were most used, hit someone, bacteria would usually carry into the wound, making it worse than infected. After an operation, they thought it was good when pus formed. They called it laudable pus, but really the pus was the sign of an infection, which would most likely kill the person. 3 out of 4 surgeries were always amputations. The surgeon usually had an operating table of a couple boards between barrels. He usually had a rag soaked with chloroform, which the patient would bite on. Surgeons usually would first cut off the blood flow with a turkey egg. Directly after, he would take a scalpel and cut through the flesh. Then he used a hacksaw to cut through the bone. Then the surgeon would take sutures and sew up the major arteries and veins. The limb would be thrown in a pile that would be discarded the next day. The soldier would be carried off the platform and another soldier would be placed on the platform. This would take only 15 minutes. Amputation saved many more lives than it killed. It was remarkably effective considering the medical knowledge of that time. Throughout the Civil War, the hospital design improved drastically. This picture is about the pavilion design of the hospital that separated patients due to their physical abilities. The design is still used today in some hospitals.